you all for joining us for this 75th session of the Flint Community Webinar on Coronavirus for 75 weeks now. We've been sharing with you and you share with us information about this global pandemic, which our goal through the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center, our goal is to bring you relevant information about how we will deal with this as a community in these global pandemic times. My goodness, it is an opportunity, amazing opportunity. I'm your moderator today and excited to be here. Yvonne Lewis as the co-director of the Community Core, the Healthy Flint Research Coordinating Center. We've talked to you for many weeks now that the Healthy Flint Research Coordinating Center is a partnership of community and academic partners. And thank you for being a part of this partnership. For those of you that are looking on, you can see that over 40 organizations have joined us these weeks to help us provide information to you. We're excited to know, and thank you, Dr. Deborah, because those community health workers, our social workers, and all of our community members that join us each week, the organizations represented here are intentional about helping bring information to you that you can use to share with the residents of the community that you support on a daily basis. So we want to say thank you again to all of our partners, and we collectively welcome you to this webinar today. We've got good information for you. There's so much happening in our community today, from the state to our local community. And we're going to start by talking to you today about some things that come from the state. But what we want you to know, our conversation today will include messages about the mask, and there are some mixed messages that we hope to clear up for you. We have representations from the Flint Community Schools, who will be talking about the school reopening. Of course, we'll hear an update from the Genesee County Health Department. And of course, there's some updates from the city of Flint. So we look forward to you putting your questions in the queue. I see somebody's already given us a question for today or comment for today. So please continue to put those questions in the queue. If you're joining us and you cannot actually be in the webinar, please give us a call at 810-835-2130. Again, that number is 835-2130. Call us and put your question in there, or you can email us at info@hfrcc.org, info@hfrcc.org. So today we're going to start with Gary Jones, who is the representative out of the governor's office. Gary, please provide us the insights that you have straight from the governor's desk.
Yeah, thank you, Yvonne, and good afternoon, everyone. The governor recently celebrated a permanent boost of food benefits that will help Michigan families put food on the table, and released the following statement applauding the United States Department of Agriculture's decision to modernize the Thrifty Food Plan. The governor is quoted saying the Biden administration has taken a significant step towards ending hunger across the United States. Increasing food assistance will help cash and time-strapped families stay healthy and feed their kids. I am proudly advocated for this long overdue increase in food benefits, and I am grateful for the efforts of the president, USDA, and especially congressional leaders like Senator Debbie Stabenow, whose longtime advocacy was instrumental in getting this done. The additional $539 million in yearly SNAP benefits coming to Michigan will uplift hundreds of thousands of families, communities, and small businesses as we continue our economic jumpstart, end quote. Governor Gretchen Whitmer also recently issued an executive directive to state departments and agencies to move as quickly as possible to administer an additional dose to vulnerable individuals and long-term care in the state. And she encourages all eligible Michiganders to get an additional dose to protect themselves. The directive comes after the CDC Advisory Committee on Immunization Practices approved an additional dose of the Moderna and Pfizer vaccine for people ages 12 and older who have compromised immune systems. Also, MDHHS, or the Michigan Department of Health and Human Services, issued updated recommendations for schools designed to help prevent transmission of COVID-19 with reduced disruptions to in-person learning and help protect vulnerable individuals and individuals who are not fully vaccinated, because many students have yet to be vaccinated and students underage not eligible. Layered prevention measures, including masking, must be put in place for consistent in-person learning to keep kids, staff, and families safe. And finally, MIOSHA is strongly encouraging Michigan employers to follow recently updated Centers for Disease Control and Prevention, or CDC, guidelines due to the Delta variant of COVID-19. According to the CDC, the Delta variant is much more contagious, may infect those that have been vaccinated, and may also allow vaccinated individuals to spread the virus. Prior to Delta, the probability for vaccinated individuals to spread the virus was considered low. And as always, to keep up with all of our updates, michigan.gov backslash COVID vaccine and michigan.gov backslash coronavirus are still the best catch-all websites.
Thank you so much, Gary. You bring up some very important information, and we're going to talk a little bit about the second dose or third dose of the Moderna or Pfizer vaccine in a little bit. Today, we're especially happy to have a representative from the Flint Community Schools to be here with us. Initially, we were looking for the superintendent of Flint Schools, Ms. Alina Stewart, but she's unable to be here, but she has a very capable assistant superintendent who is Assistant Superintendent Kevin Jones II. Kevin, please come, Assistant Superintendent, please come and share what we need to know about the reopening process. And I'll use your term for the scholars in the Flint Community Schools.
Absolutely. Can you hear me?
Yes, we can.
Okay. First of all, thank you for having us again. We appreciate being a part. And I am filling in for our superintendent, who is very busy handling some operations for our district. We returned to school the first week of August, and our scholars have been back in school. And I think for about 3 weeks now. We have now for our scholars to be present. We have two options for those who are struggling with the virus and may be sick or have issues coming back to school. And that virtual option is our Gen Ed option. We're working with the GISD with online learning, and that particular option starts September 7th. September 7th. So there's two different calendars in Flint right now. One is our face-to-face calendar, which started the first week of August. And our second calendar, which will be our virtual scholars, starts September 7th. And so we're excited that we are in school and our scholars are back. All of our scholars are masked up, ensuring that the footprint in the buildings are minimal. We're asking parents to sign in, take the health screening as well. We're still doing temperature checks. We're just following our safety protocols that we had in place all last year. And we want everyone to be safe. We definitely will take any questions that anyone may have. And thanks for having us.
All right, thank you, Assistant Superintendent. I love saying that. I just wanted to ask you just some clear steps. Are students asked to wear the mask when they enter the school, and do they have to get breaks during the time that they're in school?
Sure.
For wearing a mask?
Our scholars wear their mask from the time that they walk in the building. They must have a mask on. When they're outside during recess, they can take their mask down. We still require them to social distance even when they're outside as much as they can. It's not the best, and no, our scholars don't like it all, but it is what we have to do in this time. And so we're taking all precautions. Our board wants us to make sure we're doing that, and that's our ruling. So throughout the day, when our scholars, if they go to the restroom, if they're the only one in the restroom and they need to take a breather from the mask, some scholars have done that But we're telling them every time that they're with others, every time that they're in the building, they must keep their mask on.
Now, in the event that they drop their mask or lose their mask, do you have enough to make sure that every scholar has masks during the day?
Absolutely. Anytime we have enough hand sanitizer, mask, whatever we need. We even have what we call our COVID room, COVID response room. If there's any scholars that may get sick, we have medical staff that's on staff that will be working all year. This is a part of our recovery plan to have a medical staff at each building outside of our nurses that will handle regular everyday situations. But our medical staff is there to assist with any COVID situations that we have. And so scholars are to wear masks on bus. We have seating arrangements on the bus. We have seating arrangements in the classroom, seating arrangements in the lunchroom. So everywhere our scholars go right now, it's a little tight. They have to follow the rules. They have to sit in the same seats. But that's us making sure that we're doing our very best to stop anyone from getting sick.
I asked that question because I had someone earlier this week talking to me and said, do the schools need any help? We'll go out and find masks for them. We'll give them whatever they need. So know that there are parents and other community members willing to support the schools in any way. So with that, are there some suggestions or recommendations that you have for those who really feel like they want to be of some support to the schools?
I think that, continuing to spread the word and be an example as adults, spread the word about mask up. Don't allow your children to, come to school without a mask. If they have a mask at home, wear it to school. If you do not have a mask, we'll provide one. But a lot of our scholars, they don't want to wear the mask. And some of them are deciding to go with this virtual option just so they don't have to wear a mask. We're saying that that's not the best idea because you need your teacher. And with this virtual option, you will not have a teacher in front of you every day. It's definitely virtual. So you will be responsible as a parent to ensure that your child is doing their work and that they're getting that work in. The only thing that they're going to be provided is a mentor. And so it's not like distance learning last year where we had teachers in front of scholars 3 to 5 hours a day. It's different. And so that's the message we're trying to get out to our families is that it's better for your child to be in school learning and instead of them being at home on a virtual option because our smaller babies, our younger babies, they need someone with them, helping them throughout the day. And so we're urging everyone to come back to school. We're listening to our health community, our local health officials. They're leading us and they're helping us get through things. And so we're going to continue to press forward until such a time as the state say something different.
Well, thank you for clarifying that virtual option, because when you first said it, I thought it was the same as last year. Oh. And so it's not the same. So parents have the option, but it won't provide that same level of interaction for their children as they had last time.
It is definitely a virtual school, meaning that you will have a teacher assigned to you, but that teacher comes from, if we decide, there's programs called Edgenuity or Lincoln Learning. Those are providers that provide education through virtual learning. And so that teacher will check up on them. They will make sure that they get the assignments. They will make sure they understand it, but they will not be on with their child every day, 3 to 5 hours a day. And so that is something that parents, we've been stressing to our parents. We had a big meeting with all the parents Tuesday of this week. We had over 120 some parents show up. They were all interested, but not all the 120 was interested once they found out that their child would not have a teacher in front of them every day, all day. So we are urging our families. We are to be in school. We're being safe. We're taking every precaution. Every staff member has to social distance, have to wear a mask. No one is exempt from that. When there's medical issues that come up about a scholar not wearing a mask, we ensure that we follow the medical plan, but we ensure that no one else will be getting harmed. So they don't wear a mask, they wear a face mask, a face cover.
Face shield.
And so a face shield, right. And so we're making sure that, you know, even those that say, well, hey, I can't wear a mask because of health reasons, well, you put on a face shield. And so we're doing our very best. We want our scholars to be in school. There's been a lot of learning loss, and Flint Community Schools is, we're committed to ensuring our scholars can recover. We have a long way to go, but with our community, with our health officials, with our parents, and all of our stakeholders, we believe that we'll get there.
Thank you so much, Assistant Superintendent Jones. Let me ask you one additional question. If parents have questions, or some of our support staff that are listening, is there a number that they can call? What do you recommend that they do?
So there's two ways that you can they can contact us. They can call 810-760-1000, and they can also leave an email at superintendent@flintschools.org.
Okay.
And their issues will be addressed.
Thank you so much. Now you're going to stay with us as a panelist. So if anyone has questions, we're going to encourage you again, please put those questions in the Q&A, and he will certainly be happy to answer them for you. Thank you so much for being with us today. Absolutely. And we'll look forward to you. Come back anytime you need to. We'll look forward to getting that update. As a segue into talking about masks, because you did mention Assistant Superintendent Jones, that some of the parents as well as the children are hesitant or just absolutely don't want to wear masks. So we've asked Dr. Susan Wolfer, who is one of our co-directors of the Healthy Flint Research Center and a medical expert, pediatrician, to give us some insights on the importance and try to address some of the misinformation, the mixed information, the wrong information about wearing a mask. Dr. Wolfer.
Thank you so much, Yvonne, for this opportunity to speak about some of these mixed messages about masks. And I think it's really important as we think about this for us to know that we are thinking about safety. That's the context for this discussion. And so as we think about safety, we know we do a lot of different things to keep children safe. Some of them they like, some of them they don't, but we still have them do it. So for example, think about car seats. We restrict their movement, we confine them in these seats, but it's for their safety. We make them face the back when they're younger, so they really can't see their parents, and many of them don't like it, but it's for their safety. We don't let them sit in the front seat. How many children want to drive up front with their parents? Many, but we don't let them do it because we know it's not safe. And we go beyond that. We make people drive slower when children are around so that we can keep them safe. And for all of us, we're told when we must stop. Our freedom is restricted. We cannot just go through that intersection when we want to, because this way we can keep us all safe. So as we think about safety, let's think about some of the questions that people have about masks. And so there are many, but I thought here's some of them. Like, will my child get enough oxygen if they're wearing a mask? Will they be able to breathe? Will they breathe in too much carbon dioxide? Is the virus so small that it won't get stopped by the mask? Don't we need more studies? You hear that one a lot. And why did they tell us that we didn't need masks in the beginning? And now they say to us, well, you do. And then will it affect my child's language and emotional development? So I'd like to take each of these one by one. And if we start off with the language and emotional development, there is no evidence to suggest that children will be emotionally harmed or that there'll be any developmental delay from wearing a mask, particularly if we're talking about children who do not have special needs. And so it's a whole different conversation if we're talking about special needs children, but those who do not have special needs, there's no evidence to suggest that this is a problem. We know that language development, a lot of it has occurred before the time of kindergarten and later, when we're suggesting wearing masks. And we know that children who are vision impaired develop very good language skills. And so we know it will not impact that. Along with that, the masks are to be worn in public, but at home, when children are with their parents and their families, then they get to not have to wear a mask, and they get as much of that expression and that they need. And so just in the hours of school, wearing the mask will not, to our knowledge, impact that. So why did they tell us that we didn't need masks in the beginning, and now they're saying we do? Well, this is really interesting. And I think this supports the fact that masks work really well. We knew they worked really well because surgeons used them to protect in surgery, and all the other staff that are in the surgery and the operating room all wear masks because that makes a difference. We know it helps prevent infection. We know masks work. Construction workers use them to protect themselves against particles when they're removing asbestos and whatever else. We knew they worked, but we knew that we didn't have very many of them. And so there was this effort to try to save them for the frontline workers so that they could be protected. We also, at the beginning, didn't know as much about coronavirus. So we didn't think you could spread it maybe when you were asymptomatic. So we figured once you're symptomatic, maybe that's when you spread it, and then you won't be out in public. So that would be the best way to go. Now we know that it can be spread while you're asymptomatic, while you have no idea you have it. And so definitely masks are a good idea. And now we have enough of them. So we don't have to worry about putting our first line responders at risk. So then, don't we need more studies? Well, I'm a researcher, so I'm going to say yes. We always need more studies. But while we wait for those studies, we should do the best we can with the knowledge we have now. And that knowledge is very much in favor of masks. And there are lots of things we do when we don't have a lot of studies about them. I mean, we don't have studies about children needing to wear shoes to school, very few studies about shoes, but we think they protect their feet, keep them warm and dry, and there's a reason to wear them. So let's look at the science behind wearing masks from what we know at the moment. And we'll answer these three questions. Will my child get enough oxygen? Will they breathe in too much carbon dioxide? And isn't the virus so small that maybe the mask can't stop it? So this makes us think about size. And the first question I think we'd want to consider is, how small is the coronavirus? So to give us an idea of this, if we take this ruler and the smallest measurement, the 1 millimeter measurement, and we cut it into 1,000 pieces, and then we cut one of those pieces 10 times more, that's how small the coronavirus is. So it's very, very small. But how does it compare to oxygen and carbon dioxide? Well, in comparison to oxygen and carbon dioxide, actually coronavirus is really very large. So if this dot, that tiny little dot down there, were oxygen or carbon dioxide, this would be 10 times bigger. This would be 100 times bigger, but coronavirus is actually 1,000 times bigger. So big, I can't fit it on the graph. There's no way to fit it on the same page when we're thinking about scale. So the one way you can think about it is, if you think about the head of a pen, if you think that oxygen and carbon dioxide are like the tip of this pen, then coronavirus is the size of a meter ruler. So it's a huge difference in size. Okay, so, well, what are the sizes and the spaces of the mask? How does that compare? And is it the right size to be able to block the coronavirus or block the oxygen and carbon dioxide that we're breathing in and out? Well, those spaces are about 3 times the size of the coronavirus. So, and for the K95 masks. And then for the surgical masks, they're a little bit bigger than that. So that should tell you, if the oxygen and carbon dioxide are the size of the tip of my pen, but coronavirus is the length of a meter rule, and the masks, the spaces, are about 3 times the size of the meter rule, clearly oxygen and carbon dioxide can move freely in and out. And all of the studies suggest that it does not lower your child's oxygen or anybody's oxygen, and does not increase our carbon dioxide that we breathe in to dangerous levels at all. So the answer to the question of do they work for us is yes, they work. And you're asking yourself, well, they allow oxygen and carbon dioxide to go in and out freely, but it sounds as though they might also allow coronavirus to go in and out freely. Well, this is where I would like to show you why that is not the case. So if you can spotlight my little bowl here and imagine that this steamer colander is a mask, and the mask is going to block things. So here's our oxygen, our little sprinkles, because I was making something for a cake. And our little sprinkles, as you see, this is oxygen and carbon dioxide. It goes through very, very easily. Very easily. You can see that it's gone through without any difficulty. Now, if we think about what comes out of our noses, what comes out of our noses are respiratory droplets. And these marshmallows are going to be my respiratory droplets. Respiratory droplets are huge, and they don't go through the mask because they are like 10 times the size, and they do not go through the mask. The mask blocks respiratory droplets that come out of our noses, but doesn't block oxygen and carbon dioxide, which are our little pink sprinkles. So the big question is, what about coronavirus? Which is about, we're going to use these colored sprinkled dots as those. See, they go through, but not as much. But here is the beauty of this situation. Coronavirus doesn't come out of our noses just as single little coronavirus, some of which could make it through the mask. They come out embedded in respiratory droplets. They come out on the marshmallows or in the marshmallows, so they cannot get through. Those respiratory droplets get stopped, and all of those coronaviruses attached to our respiratory droplet marshmallows do not make it through. So you see, oxygen and carbon dioxide goes through fine, respiratory droplets don't. And that is where all of the coronaviruses in the respiratory droplets, in the marshmallows, they don't make it through the mask. And that means they don't make it out to go and infect other people. So that is how masks are. Oh, and masks are effective in one other way. I chose a metal object because to make you think of magnets and magnetism. The N95 masks have a little charge on them, so they attract the virus to it as well. And again, on the inside. And so they stop that virus from going through. So if you're faced with any of these questions about whether a mask works, you know that they do work. They work because oxygen and carbon dioxide can move freely through like the sprinkles, but the coronavirus can't because it's in respiratory droplets that don't make it through the holes in the mask.
Wow, thank you, Dr. Wolford. Now don't go away because I'm going to invite Dr. Deborah Verholden and Dr. Lawrence Reynolds we have a really, really quick rapid fire roundtable because there's some very, very important things based upon your demonstration and the fact that we now have our children going back to school. Here's a couple of things I want our team to think about. We have a conversation going on at the Board of Health and the Board of Commissioners about masks and the directive that our health officer put out. We also have events going on in our community where people are out and about. These are very important things for us to consider. So I see Dr. Deborah, I can't see Dr. Lawrence. I know he's here somewhere, but I'm gonna give it to you first, Dr. Deborah, and then I just want you all to just really quickly give us key insights around this issue of masking and what's happening with the spread of coronavirus right now in our community.
So spread is peaking. It's getting back dangerously close to the point that it was. We have actually, if you look at just the average for this week, we've exceeded where we were March, April of last year. We're getting back to the approaching the point that we were when things were at its highest. I know it's summertime. We're in back to the bricks right now. I got a very disturbing video sent to me last night that showed a lot of people downtown, packed in, crowded in, singing, celebrating, enjoying one another. And I understand that people want to be around each other. I do also know that outdoors is best, but that is simply too many people and too close of a confined space to not be masked. So I will reiterate for people, outdoors is best and better than indoors. But even outdoors, you have to watch your density. You cannot, if you can't practice any type of distancing, it's probably not a safe environment. If you are not masked, not only are you not safe, but you've created an unsafe environment for others. And I love Dr. Wolfert's demonstration. And what I want to tell people is the masks have synergy when everybody's got one on. So if I have on a mask, that provides one layer of protection. But if all 30 people outside somewhat distance all have masks on, it starts to become this more than cumulative effect when everybody has a mask on. So outdoors is best. Densely populated outdoors is not okay. You're still at risk. And people, you've got to keep that mask on. Dr. Wolfert told us in a different week about how this strain spreads more easily, looks like it hangs around in your nose and your mouth longer, increasing the chances that you could breathe it in and breathe it out on others, or that it might have the chance to replicate. So the thing we got to do is stop it from getting in the first place. And watching your distance and wearing that mask is our best protection.
Dr. Reynolds, I hear you.
Oh, yes. Remember the Swiss cheese model we spoke about. Now that we have the vaccine is the essential fundamental defense. However, it is not 100% effective. We already know that, right? And that's why the mask is so important. Maintaining that physical distance is so important. And also watching the duration of time we spend in a crowded venue, because that increases our exposure to the virus. And so all these things work together, and we still have to wash our hands. We still don't need to touch our face, but masks are most essential. And unfortunately, in the United States and many other parts of the world, many of our school buildings do not have that ideal ventilation because no one was expecting a pandemic. So still, vaccination, masks, and outside activity when feasible are most important. And this is a tremendous challenge for schools, but we have to do it. Now, what we failed to mention is federal law requires that people wear masks on public transportation. And it's not just jets, it's also school buses. So we have to remember, as our doctor said, these things are to protect us, to protect the people we care about, and I'll add, even to protect the people we don't care about. Now, the numbers of COVID in children have been low in the past. We have a new variant. We have no experience with this virus. We do see a slow but steady increase in the number of cases throughout the United States. So we still have to get vaccinated, wear the mask, be in the best ventilated situation we can, and maintain our physical distancing. And always ask yourself the question, is it worth it? And remember what grandma said, just because you saw your friends jump off the bridge doesn't mean you have to jump off the bridge too.
Thank you, Dr. Reynolds. Dr. Wolfert, we're going to ask you, do you have something else you want to say to close this segment out for us?
Well, I just want to agree with everything that has been said. Masks are a very simple thing with very few negative side effects that we can all do to keep our children and the rest of our community safe. And one of the best things we as adults can do is to model its use for our children. So hopefully people will be able now to answer questions when they face them about masks, because they are definitely an excellent tool for us to use.
And thank you. Thank each one of you, because I'm sure there are going to be many, many more questions about masks. We have some things coming up, things right now that will cause us to have to address this. And obviously, we can't make decisions for you, but our goal here is to give you information so that you can make the best and most qualified information for you and your families. So thank you so much. We're going to find out now what's happening specifically here in Flint, Genesee County. Tabitha Young, welcome. This is her first opportunity to be with us. Tabitha is the compliance health educator at the Genesee County Health Department. She's standing in for Sherelle today. So Tabitha, please give us an update. What's happening right here? We've heard that things are changing and growing. You can give us those complete stats for Genesee County.
Good afternoon, everyone. Yes, like I said, like you said, I am filling in for Sherelle Bell Brown. My name is Tabitha, and I am here to give you the data dashboard updates for the countywide. Okay, so this is what we're seeing now. We have administered over 332,000, at least one dose of COVID-19 vaccine to the community, to the county, actually. The residents age 16 plus has received at least one dose, which puts us at a percentage of 54.2%. Fully vaccinated residents is over 164,000, which puts us at a rate at 45.1. Keep in mind, our ultimate goal is to reach that 70% eligible resident that will be fully vaccinated by December 31st, 2021. Okay, so as I stated earlier, the total doses is over 332,000. And if you look over in that far corner, you will see a breakdown of the number of vaccine administered by brand over here in that corner there, over that way. Next slide, okay. So these are the upcoming clinics and times. Tomorrow we will be at Agape Church Fund Day. I will be working that clinic. So if you know anyone that is willing to get vaccinated, the appointment times are 11 to 1. And the vaccine that we will be giving will be first and second dose Pfizer and J&J. If it's anyone that's unsure and needs a little bit more education, I will be there to help them to walk them through that. And they have any questions and concerns, I will be there for that as well. We got another clinic going on tomorrow at Salem Lutheran Church, which is 2610 Martin Luther King Avenue, Flint, Michigan, 48505. Those appointment times will be from 10 to 12. And again, we'll be doing first and second dose Pfizer and J&J. Tuesday, the following week, 8/24/21, we're going to be at Our Lady of Guadalupe on Coldwater Road. Those appointment times will be from 12 to 2. Vaccine will be first and second dose Moderna and Pfizer. Next Wednesday, 8/25/21, we'll be at Central Church of Nazarene, 1261 West Bristol Road, Flint, Michigan, 48507. The appointment times will be 10 to 2. Vaccine given will be first and second dose Pfizer and J&J. Next Thursday, we will be at Shiloh Missionary Baptist Church, 2120 South Saginaw. No, Saginaw Street, not South Saginaw, I'm sorry. Flint, Michigan, 48504. The appointment times will be 3 to 6. Vaccine will be first and second dose Moderna and Pfizer. Okay, so here's a list of the upcoming, well, the drive-through testing sites and the community testing sites, okay? You can go through the drive-through at Genesee Community Health Center, Tuesdays from 1 to 3, Thursdays, 9 to 11 a.m. Walgreens on Davidson Road, daily 9 a.m. to 5 p.m. Hamilton Community Health Network, and it'll be scheduled every 10 minutes, Tuesday through Thursday. You can go to the North Point Clinic and you can go to the Burton Fire Station. Rite Aid in Swartz Creek is also doing a drive-up testing, and those hours and times are listed below there. In Flint, Monday through Friday, 10 a.m. to 8, and Saturdays and Sundays, 10 a.m. to 5. We have community testing sites, which will be at the Word of Life Church on Atherton Road, Bethel United Methodist Church, Tuesdays 10 a.m. to 4 p.m., and Thursday, 1 to 7. Macedonia Baptist Church, Mondays, Fridays, and Saturdays, 10 a.m. to 3 p.m. Again, this information is all listed on our Genesee County Health Department website at www.gchd.us. There is no more pre-registration, thank God. You can get your COVID vaccine by visiting our website, what I just mentioned, gchd.us. You can walk into any operating location that I mentioned earlier, any of the testing sites that we're going to be doing this week, tomorrow, and upcoming next week. You can walk in there at any time during those times. If you do not have the times and the locations, again, you can visit our website at www.gchd.us. Also, too, if you're unable to visit the website, call our call center, 810-344-4800 for help. There will be someone there to answer the phone, and they can help you, and they'll get you connected to one of the facilities where we'll be doing the vaccines. If you know someone that is not able to leave their home and they need to be vaccinated, there's a link on our website at www.gchd.us, and we can get them registered and vaccinated. Again, I would like to say for any recommendation for regarding the third dose, I'll refer them to the www.gchd.us, and they can visit that page and they will get all the information regarding that third dose.
Thank you so much, Tabitha. Just jumped right in here and gave us all that information very clearly. And we thank you for that. And you just made me recall as I was listening, when we started off several months ago now in March, we didn't know anything about testing. And one of the things, once that started, testing was not available, it was not accessible, and there was certainly not equitable opportunities. And now all of those three things have been addressed. You've shared with us both the sites where testing is available, but also where vaccines are available. So for anyone in our community, when you make that decision, the vaccines are available, accessible, and there are equitable opportunities. The same with the testing sites, available, accessible, and there are equitable opportunities. So please utilize these that meet your need. Thank you so much, Tabitha, for being with us today.
Thank you for having me.
When we talk about health equity, as I said, equity was a really, really big issue for us early on. And Dr. Deborah Verhoeven was just an advocate about equity. And she told us at one point, we need to mandate equity. And because of some of her efforts and the efforts of others, and I particularly know of the efforts that she's made, that we are seeing some changes, but yet there's so much we need to do. So Dr. Deborah, talk to us about where
Thanks,
we
Yvonne. All right, so the CDC has these risk levels for us to try to understand risk, and we have unfortunately moved from the moderate, substantial level into the high risk level. We're well over their standard, which is more than I believe it's 100 cases per 100,000. Our testing positivity rate, we are literally updating this stuff hot off the press. As of yesterday, it was 8.6%. This morning, it's now been confirmed at 9%. Remember, at our lowest, it had gotten down to around 1-2%. And what that means is of all the people who are getting tested now, about 1 in 10 of them are coming back, and that test result is positive. So the word of caution, and this is not, psychic prediction. This is just good, strong epidemiology and data. The cases are going to be on the rise in Flint and Genesee County during the next several weeks. We've already seen that through this increase in hospitalizations. And we know as we have more contact and more people coming in contact with one another, the districts are going back to school and some of these other things. These large events like Back to the Bricks and things like that are just going to increase people coming in contact with one another and also spreading the disease, spreading the virus. Okay, so we're trying to give people good information, but also a little bit of a caveat. So, we give you the report out on data cases in the week prior. When we give you that data, it's based on all of the known cases that we have at the time. I remind people that cases are a function of testing. We can only identify cases as a function of people getting tested. Not only do they have to get tested, those test results have to come back. So last week, we reported, as an example, there were 166 cases that happened in the prior week. Well, those numbers have now been updated as the more test results have come back. And in fact, last week, there weren't 166 cases in Genesee County. There were 210 cases. So the caveat that we want to give people is when you see these trends increasing, so it looks like this week, the numbers are down a little bit from last week, that's likely just an artifact of all of those cases. Those tests haven't come back in yet. What it looks like, quite the contrary, is the cases are continuing to increase. It takes about 2 to 3 weeks to get full reporting on COVID cases. So please see these numbers as provisional, but do watch the trends. And it's important to note that confirmed cases in Genesee County this week, so far, there have been 180. That is far from trivial. Next slide. All right, so I'm gonna hand it over to my wonderful colleague. Doesn't she look so lovely? The creator of our health equity brief. If you don't have it, she'll tell you how to sign up.
Thanks, Zach. So I'll just go ahead and kick right off because we have some really important pieces to discuss today. So the first thing I want to address are the disturbing trends that we are seeing nationwide and in Michigan as well, with these attacks on anti-science with anti-science legislation. So most recently, as of Tuesday, a partisan piece of legislation was put forth in the House to essentially, it directly bans mask mandates in school, which is undermines evidence-based health measures, including our CDC recommendations, and is really a blatant attempt to usurp the powers of our local and state health departments right here in the state. So you'll find additional information in the brief, and like always, I'll be keeping an eye on this bill's progress, but it's all the more reason that we need our health experts we need our policymakers to engage with health experts to really raise awareness of and address the need for a third COVID vaccine for those with weakened immune systems, as you just heard Doc give the numbers and the longitudinal trends. So we just need to continue to push that vaccine for those who are ineligible or for those who are eligible but remain unvaccinated. The last thing I want to address is the need to restore the cuts that were made to reimbursement fees for those catastrophically injured. And this is a result of reforms to Michigan's no-fault insurance laws that was passed in 2019. And some elements that took effect July 1st are having some really unfortunate consequences for the families and survivors of these auto accidents, and has left them without any type of safety net. So caregivers are consistently having to work more hours. We've already seen job losses at the Eisenhower Center in Ann Arbor because of this policy. So what can policymakers do to undo this? I want to point out that even though it's received a lot of bipartisan attention, there hasn't been any action. We need the legislatures, as the recess comes to an end, to put forth a new bill and get it to Governor Whitmer to really mitigate this ongoing crisis. And in the interim, I'd suggest that policymakers seek guidance from the Treasury detailing permissible uses of any kind of fiscal recovery funds or ARP funds to as a stopgap in the interim.
Well, thank you, Mary Catherine, for that update and information. And one of the things we want to remind our listeners is we say often health is more than the absence of disease. So it's very important for us to understand all the other things that are happening, all the other issues that surface that may affect our overall health and well-being, and be a part of helping make a difference. And so that leads us now to our discussion about what's going on in the city of Flint, where we can also be involved and see what we can do to make a difference. Kiana, thank you for being here with us today. We talked and introduced you some weeks ago, but today, your first official day as the Manager of Public Health on this webinar, so welcome.
Thank you, Yvonne, that's so kind. Good afternoon, everybody. I do want to say thank you to everybody who presented today. Dr. Wolford's visuals are always so captivating and so useful in making the complicated sciencey stuff accessible to minds like my own. So thank you for that, and for everybody else who presented today. Just a few updates from the city of Flint. First, beginning with the secondary water pipeline source. The city did provide an update on August 13th, 16th, and we do anticipate another update coming sometime today, Friday, August 20th. And so in the most recent updates, we received information about the lines being flushed in the secondary water line. The secondary water line was flushed on August 14th. And again, on the 15th, there was no bacteria detected. So it looks like things are going well with bringing that secondary source online. And the city will continue to keep residents up to date on what's happening with that. The city of Flint does also have a new CFO. The announcement was made earlier this week. Robert Whittigan is the new CFO for the city of Flint. He is a Flint native. He attended Mott Community College and graduated from the University of Michigan Flint, and is very excited to be back in Flint, supporting the city of Flint. So welcome to Robert. If anyone sees him out in the community, please welcome him to the city, back to the city of Flint for work. The mayor is continuing his ward by ward tour next week. On August 25th, he will be in the 5th ward, August 26th, the 4th ward, and then wrapping up the following week, September 2nd in the 6th ward. That will wrap up the summer tour, and he does anticipate going back out into the community in the fall. So you might check social medias, especially Facebook, as there are events that are posted there to get the locations, and also to make sure that we all know where he is if we have any questions or concerns, or would like to hear updates in person on what's happening with the city of Flint. And finally, the family navigators from the Office of Public Health will be back out in the community next week at the help centers, the community help centers. So that's Bethel, Asbury, and Greater Holy Temple, providing filters and information on flushing protocols, also any recycling bags, and other materials. So they'll be there in person beginning at 9 a.m. on each of those days. And again, this information will go out on social media. They will be there at 9 a.m. and wrap up when those supplies run out every Monday, Tuesday, Thursday. They will also bring with them the testing kits so that residents are able to, again, pick up the testing kits to test their water. Those testing kits can then be brought back to the information desk here at City Hall, and those are sent off to the state for the testing. If there are any additional questions, happy to answer them here at our information desk. The contact number is 810-410-2020. And that is all I have as updates today.
Thank you so much, Kiana. And it just helps us to understand we're not forgetting the things that have already been going on in our community before coronavirus, because this is an actual important ongoing conversation we're having in the city about our water system. And so thank you for bringing us that update from the city of Flint. And we also have with us Dr. Lawrence Reynolds. And I don't know if many of you may not know, Dr. Reynolds is also a great historian. And earlier today, we had a little chat, and he brought something forward because we talk about equity. He heard us talk about being equitable in the things that we give out, but it's also important for us to remember some of the history behind this. And he pointed out that over 402 years ago on this day, a Dutch ship carrying 20 African Americans arrived in Jamestown, Virginia, a voyage that would mark the beginning of slavery in the American colonies. And so much more went on to help us to get to civil rights movements and all of our conversations today about equity. Dr. Reynolds, I'm going to ask you to come and give us some more insights about why it's important for us to remember where we've been, but also to make some steps to improve where we're going. Dr. Reynolds.
Oh, yes. It is always a struggle for human rights. For us in this country, it started at that time and it continues for us and our neighbors. And we have to continue to stand up when something is not right. And right now, the protection of our children in school, wearing masks is most important. Right now, when someone is using an industrial analyzer on humans, when the manual says don't even point this thing at humans, and people are not being informed of this, but they're signing up in hopes to get more compensation in the civil water suit. This is a violation of research, if it's legitimate research done on human subjects. So we have to be vigilant. If you see something, you got to say something. If you have a question, ask the question. Many times you'll feel like you feel like the dummy in the crowd and everybody else has the same question, but they don't have the courage to ask. So ask and find somebody who can give you credible information, and get tested if you were in the crowds, and get vaccinated, please, because these 20 people who landed in Jamestown were the beginning of our saga in the North American continent. And I might add, August 1st, 1834 was emancipation in the Caribbean islands also. So we've come a long way and we've got a long way to go.
So Dr. Reynolds, and I know this is near and dear again, Dr. Deborah, you might want to jump in here for a second. We talk about equity and health equity. All of these things are so critically important. You mentioned something a bit ago about cadence testing, when we talk about making sure that we know what our status is, and that's how we get the information on these numbers that Dr. Deborah was talking about. Can you talk to us a little bit more about the importance of this cadence testing, and maybe even explain right quick what you mean by that?
Oh, yeah. When there's the parade and you hear the drummer going tap, 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 that drummer is setting the cadence. Well, there's the drummer for COVID-19 testing. If you are unvaccinated, if you are in a highly exposed area, if there's a resistant strain going around, there's nothing wrong with getting tested on a regular, periodic basis. Just like that drummer keeps the cadence as people march down the street, you can get tested every 1 week. You can get tested every 2 weeks, depending on your setting and your symptoms. And if you are really concerned, if it's an antigen test, if you get it one day and is negative, get tested again on 3 days, 3 days after that. This is most important. So for settings like in a factory, in a school, or if you're in a setting where you just have to go there every day, cadence testing is most important. People who work in nursing homes, it's important. People who work in hospitals, people in public safety, people who have jobs where they have to show up at work. That's where it's important.
Thank you, Dr. Reynolds. Dr. Deborah, did you have a comment there? Oh, okay. I saw you. Because again, getting the testing is helping make sure we get the data right. So again, we want to just thank you for those insights today. All of our panelists, you're just absolutely wonderful every day, every Friday. And of course, to those of you that are putting your questions in and sharing with us on a weekly basis, it helps us to make a difference. We appreciate those social workers and community health workers who continue to apply for the continuing education units and your contact hours. Please, today, follow that process, identify your affiliation, and make sure you complete the survey following the webinar today. We also want to let you know that we will be right back here next week, but you can like us on Facebook at www.facebook.com/HFRCC. Please subscribe to our YouTube channel to help us bring this information to you on a regular basis, Healthy Flint. And then you can always email us with questions at info@hfrcc.org. give us a call at any time at 810-835-2130, and we will be delighted, and I mean really eager to answer your questions, because that helps us to see what we should be continuing to have as part of our conversation. Again, let me thank you all for joining the Healthy Flint Research Coordinating Center's Healthy Flint Community Webinar on coronavirus this day, August 20th, 2021. Thank you, and we look forward to you joining us next week.